Great. So this is a 10-year-old who presents with heel pain. And what we can see on this sagittal fluid sensitive sequence is that at the insertion of the Achilles, we have this elevated signal intensity in the posterior calcaneal apophysis. And what I'm going to be doing is looking to see whether or not there's any true fluid within any of these plates that would be more indicative that we have a Salter-Harris 1 fracture ensuing. But right now I would call this stress response at the posterior calcaneal process. And I'm looking at the remaining bones and I'm seeing that there's all sorts of elevated polka dot-like signals and changes. So I'll be looking to get a sense of that on some of my other fluid sensitive sequences to see where this edema really is, to give me a clue of the biomechanics. And some things I can see is that there's more edema along the medial talar neck. There's a bit more edema at this lateral talar body. I see that the medial navicular process has some changes. Even the middle cuneiform seems to be elevated signal intensity. And altogether, putting this together, I'm thinking there may be some biomechanical alterations. So I'll start to assess the joint spaces. And in a 10-year-old where they're not fully ossified yet, this can be challenging. So I'll always go to the middle and anterior subtalar joint to get a sense of the anatomy and understand, do I have any osseous coalition? And I'm going to be looking on the T1s and just at all of the joint spaces in terms of seeing whether or not there are two cartilage layers or one cartilage layer, because that can be a cartilaginous coalition. And I pay close attention to this special area just anterior to the posterior subtalar joint. If you go medially, there's an area just called the extra-articular area. And this is an interesting area. When we look at the middle facet of the sustentaculum talus and the middle facet of the talus, we see that they should be on a certain plane. And as we move posteriorly, we begin to see that there are some signal changes on the talar side. And the elevation of the angle here may be giving us a clue to restricted area of motion at the medial area here. And this would be functionally termed an extra-articular talocalcaneal fibrous coalition. Now, the child is only 10, so these are just early clues. So it's not a surgical implication at this point, but something biomechanically for us to watch and work with as we try to put the child into the best biomechanical position. So I begin to use that as my working schema, that there may be a restricted range of motion, and look for the hindfoot adaptive mechanism within the patient and start to look at what ligaments are spraining. So I'm going to go to my coronal sequences and check out my deltoid and see that it's mildly thickened. I don't actually see the fibers anymore. So this would be indicative of a subacute to chronic sprain. In addition, that change of the medial talar neck tells me that there may be some biomechanical problems medially. Looking at our coronal image, we're always going to be able to see that flexor retinaculum. And in a 10-year-old, I don't expect them to be overly sprained, but I'm paying attention to the early sprains. Let's take a look at the ATFL. This is slightly thickened than what is normal, so that's a chronic sprain. And looking at the PTFL, also slightly thickened, and I begin to see this posterior talar process and some slight elevated signal intensity, which can be normal as these are growth plates growing. But given the surrounding synovitis and the bone marrow edema that seems to be more prominent on the calcaneal side, we can think about the fact that there are strains occurring for this child to get from the heel strike position to the toe off position. And when we understand that, what's happening here may be that there's restricted range of motion in this area of this extra-articular talocalcaneal facet, and that we're going to use all of the other ligaments that can get the talus and the vector closer to the first ray and get that toe onto the ground. Currently, there's some experimental things that I've been thinking about on how to look at these things, but I look at sometimes these talar lines of stress. This has been written up in anatomic texts in veterinary texts about the actual trabecular lines of stress. And when I think about the vector of this talar head, if I were to bisect that and do my bisection line, these lines may be telling me about the type of biomechanical work that the talus must have to do to get the biomechanic to get into the toe-off phase of gait. And we'll talk more about that in other tutorials. But for this tutorial, what we're presenting again is Achilles tendonitis. This is a form Frust of Sever's disease. And in a 10-year-old child, we can understand that this may be a biomechanical response to changes that are occurring at fixed joint spaces. So I think earlier identification of these areas can help us get improved appliances and orthotics into the children's shoe and understand how to better offload these areas before there is cartilage damage. Thank you.